Welcome to Health Coach for Women, a podcast where we explore alternative and holistic solutions to better health and wellness through intentional living. Now, here's your host, Marsha Roopchand-Walker.
Hello and welcome back to my channel. Thank you so much for tuning in today. Today, I want to dive into a very important topic. All right. I thank you so much for tuning in today, for tuning into my channel. If you haven't done so already, please hit that like button and share and subscribe. Of course, I'm your host, Marsha, and thank you for listening to this podcast where we talk about holistic health, right? Exploring alternative solutions for better health and wellness. All right. So today's quote: health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is by the World Health Organization. All right. So I want to talk about managing your A1C. All right. I want to dive right in. So this topic is crucial for many people, right? Millions of people around the globe. Many people are dealing with type 1 and type 2 diabetes. And so whether you are directly affected or not, or you know someone who is, understanding the importance of the A1C and how you can manage it is essential for a healthier life. All right. So what exactly is your A1C? So the A1C, also known as HbA1c, which is hemoglobin, is a blood test. It's a blood test that measures the average glucose levels or sugar attached to your hemoglobin, okay, over the past 2 to 3 months. So what that does when you do this test, and you can do this test at home, and I'm going to go into that further, it measures what your hemoglobin levels are, with managing that, checking those levels for the past 2 to 3 months. All right. And so it's a vital indicator on how well your diabetes is being managed. All right. And it gives you that long-term view of your blood sugar levels, which is great. All right. So who does it affect? It affects those, like I said, with type 1 diabetes, as well as type 2 and also for pre-diabetics. All right. So managing your A1C can help in the prevention of the progression to diabetes, because diabetes comes with a lot of complications, right? All right. So in addition to that, diet and physical activity, as you know, are critically important in managing your A1C, right? As well as your blood pressure and your cholesterol. All right. So now to reach your glycated hemoglobin, right? The A1C, which is the A1C goals, and being able to achieve your blood sugar targets is important, and understanding how to balance food intake as well as physical activity and your insulin. All right. So what are the normal levels of the A1C level? So normal levels are normal range level is below 5.7. And while a level of 6.5 or higher, test indicates diabetes. All right. So people really generally, on a general, like to have their levels below 7%. Now, this here is according to the American Diabetes Association. So their guidelines from the health organizations, such as I mentioned, American Diabetes Association, they say for most adults with diabetes, achieving an A1C level of below 7.7%, which is at 6.5 range, is recommended to reduce the risk of diabetes, all right, which is 154 milligrams per deciliter. All right. So now there are more stringent or relaxed targets that may be appropriate, right? Depending on the individual factors, such as a person's age, the length of time that they had their diabetes, the presence of heart disease, and the risk of hypoglycemia. Okay, so some individuals, some younger patients without significant cardiovascular disease may benefit from a lower target, such as 6.5%, to further the risk of complications, provided this can be achieved without significant hypoglycemia, right? So what is hypo is low. So low blood sugar, as hyper is high, okay? Or other adverse effect treatment. So for older adults, the history of severe hypoglycemia, limited life expectancy, advanced diabetes complications, or extensive comorbid conditions are less stringent, such as less than 8%, is what they're saying. So it may be appropriate to avoid hypoglycemia and to balance the quality of life with treatment burden. So as you know, with diabetes, it can come with a lot of complications, right? If it is not managed properly, right? If it is not managed properly, you can experience all types of disease and complications. So what are some of those types of diseases and complications that a person can acquire from having well, I wouldn't say type 1 and type 2 because it can come from either, from having diabetes, complication of diabetes, a heart disease, stroke, kidney disease, right? Nerve damage, neuropathy, eye damage, okay? Digestive problems, erectile dysfunction, skin problems, infections, dental problems. There's so many, there's just a list here, right? For all these different things that one disease can cause other complications. So that's why it's so important to be able to manage your A1C level, manage your A1C levels, do a test, right? Do a test. There are different tests online that I'm going to have a link in the description. And I think that one is called AccuCheck. I believe it's called AccuCheck. It's an at-home test that you can take, right? And remember, the test, it's just a finger prick, right? And it's a simple, easy instructions. I looked at the reviews. I compared it with other ones, and it had very affordable kit. But the test can help you, right? So if you can be able to look at those levels, analyze those test levels, look at the test levels once you get it. Remember, it's a 2 to 3 month window, right? Of going 2-3 months back. So if you do this on a regular basis, incorporating diet, right? A healthy diet, exercise, physical activity, you can manage those A1C levels. It's not impossible, okay? It's not impossible. All right, so now remember, now it's very important to personalize your goals with your healthcare professional, right? And there's various treatment options as well as health benefits and risks. So, regular monitoring is important. All right. And so how do you manage that? Well, I talked to you about that AccuCheck, I think it's called AccuCheck. Now this one is it's an A1C test, right? And you can find it on Amazon. All right. It retails for $63.99. And it's an at-home kit. It comes with a pack of 4. Right? It detects the A1C levels. You get the results within 5 minutes. It's a 99% accurate, displays in 5 minutes. And I'm just reading, this is what it have here, right? Requires only a small finger stick of your blood sample, right? It can be stored at room temperature, compact batteries. It's affordable and easy to use, all right? And customers give this a 4.3 out of 5-star rating. They like the ease of use. They say it's an easy guide to follow, and they also like the diagnostics. All right. So try getting one of those. You can also go in the store and purchase them too at CVS. I think CVS carries them as well. There's different brands. But this one that I found, I went and did some research. This one that I found was a cheaper one and has good reviews. Of course, just to be transparent, I do receive an affiliate commission, right, for anything that you would purchase through my Amazon link. All right, just wanted to put that out there. But I researched it, and that's what I found, and this one was affordable. All right, so now diet, right? Of course, you know the routine, the same thing I say pretty much every week, right? Fruits and vegetables, whole grains, lean proteins, foods with a low glycemic index, right? Food with low glycemic index. What are some of those foods? Okay. All right. So low glycemic foods should be anywhere where it is 55 or below, right? The glycemic index, 55 or below. Anything higher than that would be considered a high glycemic. So some of those foods, and I'm just looking at a chart here, right? And you can actually buy one of these charts if you need to have them. You can, I don't know, screenshot and make a copy off your YouTube, off your YouTube, off your device, right? And you can screenshot it and save the list, make a copy. You can do that, or you can purchase something online, and they provide a chart, right? So what are some of those? Now, they have snacks, they have different things. Now, white rice, they have the glycemic index is 38. You got, now I'm going to read you all the ones that's below 55, right? I'm going to start with that one. So they have pizza, surprisingly, pizza, 33, chocolate bar, 49, pound cake, 54, popcorn, 55, an energy bar, 58. It's a little over. Soda, all right? Soda is on here, but this is for 72. So no, we don't want that, right? So you want to stay away from that, all right? White rice, 38. Bagels, plain bagels, 33. Broccoli, 10. Cherries, 22. Look at the fruits. Apples, 38. Orange, 43. Grapes, 46. Kiwi, I love kiwi, 52. Bananas, 56. Pineapples, 66. So pineapples is a little on the high side, as well as watermelon. Watermelon. Surprise, surprise. Okay, did not know that about watermelon, guys. All right, did not know that about watermelon. Dates, I know dates. So if you like dates, it has a very high glycemic index. It's 103. Okay, it's 103. So plain yogurt, 14. Whole milk, 30. Chocolate milks, 35. Mushrooms, 10. Onions, what is that, 10. Energy bar, I mentioned that already, 58. But look at the ones that are high that you need to stay away from, right? I already mentioned dates and watermelon, right? Not to say you can't have watermelon at all, right? But the dates are very high. That one has the highest number on the whole chart that I'm looking at. All right. So soda, 72. You know you should be staying away from soda anyway, right? Those carbonated drinks. Donuts, 76, like I mentioned before. Which was the ones I'm trying to see this one here. I can't really see what it says, but pretzels, 83. Baked potato, 85. All right. So it may help you to get a chart. It may really help you to get a chart so that way you know, like, okay, if I'm eating this and I want to manage my A1C, I want to keep my levels low, below 7%, at least a 6.5 or below 7%. This is what I need to do to try to keep it low. So again, you can get the glycemic chart. You can screenshot it off your phone somewhere, print it off, right? You don't have to pay anything for it. And look at the food list, right? Check out the food list and see the different things of what you can have and what you should stay away from, right? So I just wanted to share that with you. So you want to have, remember, the low glycemic is 55 or below. All right. So that's what you should be focusing on. Okay.
If you are struggling with health issues like chronic pain, being held back by past traumas, or feeling overwhelmed and hopeless, please know there is hope. There is help. Transcendence, a woman's guide to healing and self-love for better health, happiness, and abundance, is a blueprint to help you get your life back and reclaim your health. Within its pages, you'll learn how to elevate your existence by shifting your mindset toward the positive, focusing your energy on what's really important, using gratitude to feel deep appreciation, changing your gene expression through epigenetics, building resilience, and living in a state of flow, feeling love overflow within. Go beyond an ordinary life. Transcend. Buy it now.
All right. So now I talked about, I just went into that, incorporating your fruit and vegetables. All right. I talked about berries, fruits, raspberry. Now, berries are, all of these things are good for you. Berries, strawberries, blueberries, raspberries, blackberries. They're all rich in fiber, vitamins, and as well as antioxidants. So you want to get those fruits in, right? You want to get those fruits in. Cherries have a low glycemic index, and they are a good source of fiber and antioxidants, right? And all the ones that I just mentioned, berries, strawberries, blueberries, raspberries, blackberries, they're all rich in fiber, vitamins, and antioxidants, and have a lower GI, right? So these are some great choices. All right. Apples, pears. I'm not going to go into all of them, right? Apples, high in fiber, as you know, rich in vitamin C. Pears is also on the low GI. Peaches, oranges have a low GI. Fiber, again. Kiwi, also rich in vitamin C, has a low GI, and it can aid in blood sugar levels, right? And it can aid in the blood sugar levels and provide other health benefits as well. Grapes, all right, is a medium glycemic index, right? Plums and peaches also have lower glycemic indexes, all right? So it's important to remember that fruit contain natural sugars, right? And so portion control is important. Portion control is key, but integrating these fruits into a balanced diet along with your regular physical activity, right, and other healthy lifestyle choices can help managing your A1C. All right. And now, exercise, right? Oh, also always consider, whole fruit instead of fruit juices, right? Consider whole fruits rather than fruit juices, all right? Because of course they contain more fiber. But let's move into exercise, right? How often should we exercise? We should exercise regularly, right? Several times a week, for at least for a total of 90 to 150 minutes per week, right? So that's attainable, right? That's attainable. We just need to discipline ourselves. What else is important? Managing stress management, right? That's very important stress management, because we know when we increase our cortisol levels, what happens, right? It's not good, right? So the body is stressed, and that is not healthy for the body. Now, there's going to be natural periods of stress, right? But chronic stress can become a problem. So you shouldn't be having chronic stress, right? You should not be experiencing chronic stress on a daily basis, right? And if you are, you need to work. Oh, I hit the camera. You need to work on managing that stress through techniques such as meditation, deep breathing exercises, right? And finding ways to release the stress, right? Whether it's journaling, whether it's doing your art, writing poetry, writing, journaling, whatever, all right? Have an outlet. You need to have an outlet. Proper medication, making sure that you adhere to your medication, right? Making sure, and also being able to let your doctor know if there is something that you feel like maybe a medication may be too strong, it's not agreeing with you, you have to be your own advocate and speak up, right? You have to be your own advocate and speak up. If a new medication is making you feel a little different, not yourself, let your healthcare provider know, okay? He or she only knows what you tell them, okay? So you have to make sure you let them know. Get it. And also, moving on to quality sleep. Sleep is important. You want to make sure that you are getting proper rest, right? That is important for the body. The body needs proper rest daily, right? Some people can function, or they say 7 to 9 hours. Some people can function rather off of 6, like myself. But you know your body, right? So whatever is suitable for you, getting enough rest is important. All right. So you need to incorporate all these 3 things. Now, here are some natural herbs and spices that I want to get into that has been researched, okay? Has been researched and has been found to show their potential benefits to help regulate blood sugar levels and contributes to balancing those A1C levels. And so here they are. Cinnamon, okay? Studies suggest that cinnamon may help lower your blood sugar levels by improving insulin sensitivity. And adding cinnamon to your diet is easy. You can sprinkle it in some oatmeal. I enjoy putting it in my oatmeal, yogurt, and you can use it in your cooking. Now, I don't know if I'm saying this one correctly. Fenugreek seeds. I guess that's the name, I'm not sure. They're high in soluble fiber, and they can help lower your blood sugar levels by slowing down digestion absorption of carbohydrates. Okay, so this can be taken as seeds or in capsules or used as a spice on food. All right, so maybe you can add it to your salad or something. All right, so the next one is Gymnema sylvestri, often called the sugar destroyer. It's an Ayurvedic medicine, and it's used to help reduce the sugar cravings. All right, and it can potentially lower the blood sugar levels. All right, so that is Gymnema sylvestri. Bitter melon contains 3 active substances with anti-diabetic properties, right? Including charantin, I hope I'm saying it correctly, which has been confirmed to have blood glucose lowering effects. Berberine, remember I talked about berberine before, right? Helping with weight loss, right? And they actually have supplements that you could take that contains these ingredients, most of these ingredients in it, right? The berberine capsules, the ancient bliss that I mentioned before, that also helps manage your cravings, right? And help with weight loss, right? Berberine, ancient bliss, that's the one I have tried and used before. So they say that the berberine, that particular pill, I don't have the bottle with me, but it came with cinnamon. I don't remember some other stuff that it came with. I think turmeric, ginger, cinnamon, like I mentioned before, and some other little ingredients that's supposed to help with weight management and craving your appetite. Okay. So you can try that if you want a natural approach. Aloe vera, okay, and I'll leave a link in the description for the berberine as well as the test kit. Aloe vera is known for its healing properties. It can help lower your blood sugar levels for people with type 2 diabetes. Aloe vera, turmeric, and I talk about turmeric because it contains curcumin. That's the active ingredient in turmeric, which can help lower not only inflammation, but helps with blood sugar levels and managing the diabetes symptoms. All right. And ginger, another one is a ginger, helps to regulate the insulin, metabolism, and potentially lowering blood sugar levels in people with diabetes. Okay, so this is what I have here from doing my research. Now, while these herbs do promise some supporting benefits, and managing type 2 diabetes and managing your A1C levels, of course, you do have to make sure that you stay connected with your healthcare professional, right? And before doing any treatment, you should always consult with your doctor first. So I got to put that out there. All right. And so, and if you're taking any prescription, any type of medication, you want to make sure that there's no indications, there's no conflict, there's no type of where what you're taking can can cause some type of adverse reaction with whatever medication that you're taking. So always be informed, always let your doctor know what you would like to do, discuss your goals and plans. And if you're dealing with a regular traditional Western medicine doctor, they may not understand all of the natural remedies involved. And because that's how they are trained, right? They are trained to treat symptoms and diagnose rather than look at the root causes. So you may want to consider, someone who is an alternative practitioner, right? Someone who incorporates integrative medicine as a practice, right? Who looks at Western medicine, but also looks at alternative medicine and integrate those, right? Because you can do that. You can do that. All right. So I think I covered just about everything. I'm just making sure I have my notes, guys. I have my notes so I can cover everything. All right. So of course, managing your A1C, it is a comprehensive process, right? And it does involve lifestyle changes, right? It involves lifestyle changes as well as taking your medication if needed, right? There are people who came off their medication. There are people who've been diagnosed of having diabetes and refuse to take type 2 diabetes and refuse to take the medication. And now they no longer have diabetes. They no longer been diagnosed with diabetes because they changed their diet. Okay. Just by making simple changes, changing your diet, changing the things that you eat, what you eat, when you eat, why you eat, how you eat, right? So all those factors. So it's important. It's important. All right. So I hope you enjoyed this episode. Again, I'll leave a link in the description. Okay. Health is important, guys. I can't stress that to you enough times, how important health is, right? Without your health, you have nothing, right? Without your health, you have nothing. So, people will look at having wealth and money, and there's nothing wrong with that either. But health is important because you don't want to have your leg amputated. You don't want to experience going blind or some type of horrible experience where you can't enjoy life, all because of something that could have been prevented had you managed and made the change, had you decided and made the choice to change. All right. So that is all I have for you for now. I hope if you liked this episode. If you did, please go ahead and hit that like button, share, and subscribe. Until next time, bye for now.
Ladies, do you find yourself caught in the daily grind, juggling between the demands of your career and personal life? Do you dream of thriving both professionally and personally in 2024, but feel overwhelmed by the constant struggle? I understand the challenges you face, and that's why I'm thrilled to invite you to join the 5-day Radiant Soul Challenge. Picture this: a life where you have the secrets to not only survive, but thrive in both your career and personal space. The Radiant Soul Challenge is designed for women just like you, ready to break free from the chains of stress and achieve optimal health. Here's why you should be a part of this exclusive experience. Learn the secrets to thrive both professionally and personally in 2024. Discover actionable insights that will propel you towards success in your career while maintaining a fulfilling personal life. Create more work-life balance for better optimal health. Uncover strategies to strike the perfect balance between your personal aspirations and your well-being, ensuring that you're at the top of your game without sacrificing your health. Implement proven strategies for stress management and productivity skills. Say goodbye to stress overload. Acquire practical techniques that boost your productivity and keep stress at bay, empowering you to excel in your career with ease. Don't miss this chance to embark on a soulful journey. Join the 5-day Radiant Soul Challenge and redefine your path to success. Click the link below and secure your spot in the 5-day Radiant Soul Challenge now. Your thriving future awaits. Hope to see you there.
Thanks so much for tuning in to this episode of Health Coach for Women with Marsha Roopchand-Walker. If you've enjoyed this episode, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. That helps others find the show, and we greatly appreciate it. Once again, thanks for tuning in, and we'll catch you in the next episode.